Hello, everyone. Welcome to Sama Saturday. We're back here again on our special Sama Saturday session with Dr. Katie Kangas, the amazing integrative vet. She's based in San Diego. She has the Integrative Veterinary Care Clinic in Sorrento Valley. And she comes along with Sama Dog the second Saturday of every month to share some really important, powerful, life-changing information around well-being for our dogs. There's no better person to learn it from than Katie. So thank you so much, Dr. Kangas, for being here again with us.
It's my pleasure. Thank you for having me. I really, really love to contribute and be of value and help to as many pet parents as I can.
So authentic and sincere you are. I mean, really, I just see you go. And I was reading your reviews on your Facebook page the other day for some random reason. And I saw so many people unbelievably thrilled with their experience with you saving their animals' lives. And the most important common thing I heard was you go so far above and beyond. It's unbelievable. And so thank you for that.
Thank you.
Today, hello, Kate. Nice to see you there. As you guys are jumping on, do let us know that you're here. Just comment below or give us a reaction. And of course, we're very grateful anytime you're willing to share this out there. Today, we are talking about canine cancer. We know that this epidemic has been just claiming more and more of our animals, especially dogs, as time goes on, and it just seems to be getting worse and worse. And there are some very good reasons for that, and there's also ways that we can help our animals and prevent this and help them to build a force field to have a long and happy life. And so that's what Dr. Kangas will be sharing with us today, helping us to get an understanding overall, and then of course answering the question of what do we do about it. So Dr. Kangas, why don't we just kick it off now with the question of, why are we seeing so much cancer in the dogs of the world? And what are the rates? Just share that with us, I'm sure.
This is good intro, as to what is contributing to the cancer. And I want to preface that with saying that this is a topic that's very dear to me because I do see a lot of cancer patients at my integrative practice. Obviously, that is one, most chronic diseases, but definitely cancer. A lot of people are looking for answers outside the box, outside conventional medicine, because obviously there's a lot of limitations with what we can do. And so I do see a lot of cancer patients, and I'm thrilled when they come to my practice and come through my door because there's so many things I can offer to help. And it's a very scary thing to work through for any pet parent, obviously. And it is becoming so common. There's different rates of cancer amongst, different breeds and different types of cancer. But for instance, just an example, there are statistics proven or studied that, for instance, golden retrievers are known to be high on the list for being prone to cancer, unfortunately. And the estimates are that 67%, 2/3 of golden retrievers will get cancer at some point in their life, some type of cancer. Wow. So it can literally be that high. So I love getting dogs in when they're young and even puppies, and we can start them off on the right foot with a lot of lifestyle things and diet things that will make them more resilient to ever getting into a cancer pattern. But certainly if they're already in that situation, I am thrilled to be of value and thrilled to help. So to get into your question, there's many reasons, actually multifactorial, of why so much of cancer is occurring for both dogs and of course humans as well. And we can quickly run through some of the factors that are lending to this issue. But one of the first things is nutrition, of course, poor nutrition, a lot of things that are changing as modern times take over and we have all this processed food and heavy heating of, processed pet foods as well as human foods, as well as toxins in the food the food is altered by things like GMO. Most people have heard of, genetically modified engineering for foods, and that makes a change as well. And then glyphosate and Roundup and other toxins. So there's a lot of things promoting poor quality foods that are then promoting inflammation and degeneration of cells in bodies, including, of course, our cells as well as our dogs.
Yes, I think it's so common to also have people, time and time again, they're facing these situations with dogs and their cancers. They're not understanding why. And I know a lot of the clients that I speak with are fearful, yet don't know what to do. They're just so petrified of what happened in the past. They went through the process that, of course, can be heart-wrenching. And now they have a new animal in their life, and they don't really know how to navigate this toxic world. So what do you
Yeah.
think? Where do we start?
Yeah, so nutrition is, like I said, paramount. The other thing I didn't mention is we've talked about this briefly in some of our other Facebook sessions. So if people have been following, they've heard a little bit, so I'll just breeze over it. But the other things that we can try and omit or avoid as much as we can are toxins in water and, products that we use on our pets, dewormers, flea products and other things, heartworm medicine. So anything that we can minimize. And then also the overuse of vaccinations. So that's something that I definitely talk about with my clients as well. And the overuse of antibiotics and a lot of the conventional drugs that we use can also lend to a depleted immune system and more degeneration in the body. So that's just a brief overview of all the things that we can try and address to support better health and better balance in our dogs so that they don't succumb to cancer and other chronic diseases. So, but as far as diet, this is one of the first things that I talk about with all of my pet parent, clients, regardless of what the pet is there for. But certainly with cancer, we talk about some very specific things with diet. But my goal is always to hopefully get them off of dry, heavily processed food if possible, and onto the freshest, the freshest type of diet that works for that particular pet and that pet parent's budget. And so we talk about, all the different options that we can do there. And with cancer, very specifically, I'm a big fan of ketogenic diets. And a lot of people have probably heard this term. Ketogenic diets are very popular for people right now as well. And we are really looking at these to be such an asset for dogs for many reasons. And just to briefly describe what a ketogenic diet is that's a diet that's much higher in healthy fats, still maintaining a moderate level of protein and good veggies, but very low carbohydrates, because carbohydrates turn to sugars in the body, and sugars actually feed or fuel inflammation and cancer cells. And it turns out that we now know that cancer cells essentially cannot use fat as fuel. They actually require glucose or sugar, which gets broken down from carbohydrates. So the beauty of knowing that is that if we feed our pets or ourselves diets that are higher in healthy fat and very low carbohydrate, we can actually help to starve cancer from the body because cancer doesn't have any fuel. So that is a really, really wonderful tool. It's also used, by the way, for weight management, anti-seizure, and other things. And it's good to know that ketogenic diets are just plain old anti-inflammatory, because sugars and carbohydrates lend to more inflammation, fueling the inflammation in the body. So all kinds of chronic inflammatory patterns for dogs and people, whether that's autoimmune disease, even things like rheumatoid arthritis, all kinds of inflammatory issues and chronic diseases like cancer will completely respond to a ketogenic diet. It's quite fantastic. And just so everybody gets a nice idea of how much focus this is getting in the veterinary circuit, I actually went to a conference last June, almost a year ago now, that was, I'm just going to show, my book is at work, but here's a picture of the continuing education booklet that I got when I went to this conference, and it was completely on ketogenic diets, 2 days on ketogenic diets for pets with cancer. And so a lot of information coming out on that. So I definitely counsel on diet.
Yeah, it's fascinating. And something also that comes up so much is the ketogenic diet for human beings as well. And there's a conversation there. So now thank you for helping us to understand it a little bit better. Jumping back just for a moment to vaccinations, because it's something that obviously everybody's told to do. I'm sure hear it constantly too, is like people just following their vet's directions and kind of these standards that as time goes on and as people are learning more about what's causing the cancers, we're seeing, as you mentioned, that vaccinations are such a big part of that, but yet so many vets are still recommending the standard vaccinations. So, I know it's a big topic, someone will get into in a full Facebook Live sometime, but just share a little more on that. How do we manage that with our vets and not making it, so often we feel bad, like we're not doing the right thing for our animals?
Yes, it's so important to get educated and also to hopefully find a veterinarian that that resonates with your beliefs and your knowledge. There are more and more veterinarians, luckily, that are, especially newer graduate veterinarians that are more recently out of school, that are more progressive with the information that they have. And it's now been well established in the veterinary field that we've been over vaccinating for decades. And the annual vaccination recommendation was arbitrary. I mean, there wasn't any research done to know. And I mean, it certainly doesn't make a whole lot of sense that for an animal that's going to live about 15 years, when we live about 80 or so years, we don't get vaccinated every year of our life. And so, it kind of intuitively, now in hindsight, everything's so much clearer, seems inappropriate that we would have been vaccinating them every year. It just took a while for enough research to be done for it to be established and proven that once they accomplish immunity, that lasts for years and even up to lifetime for a dog, and we don't need to be repeatedly vaccinating them. Now, you can support vaccinating them, obviously, when they're young puppies, so that they get this level of immunity, which then they can be protected from the viruses that they'll be exposed to. But I am, as a holistic or an integrative veterinarian, I'm very conscientious about counseling people, even as puppies, using vaccines that are more minimally, not as comprehensive, with as many viral components in it that may not be needed and things like that, and the number of vaccines and the ages that we do it at, and all that sort of things can be adjusted for the best interest of the pet's immune system. And so those are all things that everyone should be talking to their veterinarian about and researching to a point where they feel comfortable with bringing some knowledge and talking that through with their veterinarian, so that there's a good agreement with what they feel comfortable with for their pet.
That's great. And I've been through the experience recently because I needed to license my dog. So often that's the whole reason we almost need to, is either for that, to get the rabies certificate, or if we want to bring them to boarding, or maybe they travel or something like that. And so I just opened the conversation too, with you, and started to understand the options better. So that's great, because the vet just says it's time, or you get the reminder in the email and it's like, it's time, you just go in and do it.
So now the reminders that people should really be getting are reminders for vaccine titers, and honestly really shouldn't need a vaccine titer more often than every 3 years at most. But a vaccine titer is a much better idea than just vaccinating without knowing if the pet really needs it. And what a titer test is we draw blood and send it to the lab, and the lab actually analyzes for the level of antibodies that are in the pet's bloodstream to see if they do have enough protective levels. And the vast majority of the time when titers are run, the pets are protected. But it's good to do those maybe every 3 to 5 years, but that's much better to do in lieu of a vaccine. And for people who board their dogs, or their dogs go to doggy daycare or groomers or things like that, it's definitely good to find a facility that honors vaccine titer tests rather than forcing you to vaccinate your pet. So if people tell me, oh, my groomer requires this, or my doggy daycare requires this, and I say, well, let's have a chat with them. And if they won't, approve from my recommendations, then I would find a new groomer or a new facility. It's that important. You shouldn't let anybody force you to over-vaccinate your dog, because that definitely lends to immune system issues and diseases over time.
Yes, it's like a misconception, I think, for many years now, that vaccines make us healthier.
Right.
It's just
And we
not.
now know, yeah, that probably most, but definitely a lot of vaccines carry more risk than benefit.
Yeah.
And
Yeah.
yeah.
It's great. So we are talking today with Dr. Kangas, everyone. If you're just jumping on, I saw some of you joining in with us just a few minutes ago. So we'd love to take your questions if you have anything that's coming up. If your animal is currently facing cancer, or if one has in the past, maybe you've overcome it. Tell us your story. We'd love to hear what's going on. And Dr. Kangas is obviously the person to ask these questions to, so don't hesitate. Bono the doggy, and his mama Amarina, let me put this up there, has a comment here. Hello, removed a growth that was from left ear exterior, diagnosed malignant skin melanoma. Other tests look good so far, not spread, but we are waiting on complete pathology report for treatment plan. All advice welcomed.
Absolutely. So I would, definitely start with diet. I don't know what you're feeding. Is it Bono? Yeah. What you're feeding Bono, but definitely, the freshest diet possible, whether that's a raw diet or freeze diet, dried or dehydrated. And then there are a lot of wonderful supplements, and we're going to actually head into that now. I don't know if you want to start talking about that, Amanda,
Yeah.
at the moment. Okay. So there's many different supplements that we can do. And if you are coming to see me in my practice or doing a phone consult with me, I may get very specific too for things that are more even tailored to a melanoma. But for cancer in general, there's a lot of things we can do, and we can get into things like Chinese herbs and things like that. But even just nutritional supplements, there are 3 nutritional supplements that are, kind of on the top of my list. And I would definitely advise to add those in for Bono if you're not already doing them, and we can go through those. The other things that I will mention real quick, so I don't forget to round back to this, is medicinal foods in the diet, what we call functional foods or medicinal foods, would also be very beneficial regardless of what diet you're feeding. And Amanda and I covered this in one of our first Facebook sessions that we did together several months ago. And just to briefly recap, some of the foods that I have on that list are things like coconut oil and sardines and pasture-raised eggs and fermented foods and things like that. And those are all going to help the immune system. And a lot of the foods on that list are also high in healthy fat. So those will also help to fight cancer. So those are good things to know about. As far as the nutritional supplements, I would love to just mention 3 that are very, very, worthwhile doing and very valuable to assist the body in fighting cancer. And the first one of those is some really good source of omega-3 fatty acids. And that could be a very quality fish oil, or there are lots of other oils that are being used now, like krill oil and even calamari oil. I do actually carry calamari oil at my practice, or squid oil, because it is more sustainable and cleaner, less contaminated than fish oil, and way more sustainable than krill oil. So that is another nice one. But of course, I always like to go straight to the food for good food medicine. So we can feed sardines and anchovies and, other healthy forms of or food forms of omega-3 fatty acids, salmon and things like that, wild-caught salmon. So those are all good things. Just so you know, there actually have been extensive studies done on omega-3 fatty acids in the treatment of cancer. And Dr. Ogilvy, who is actually here in San Diego in Carlsbad, but he is world-renowned for speaking internationally on, he's a veterinary oncologist, so a veterinary cancer specialist. And he's got a slew of articles out and a lot of information. He's a huge proponent of adding high doses, higher than what we would say for an average daily supplement of fish oils, okay, and of omega-3 fatty acids. So those are known to be anti-inflammatory, period, for, the whole body, but they definitely are very helpful for cancer, and they also add healthy fats to the diet too. So kind of for 2 reasons. So that's one of the things that I would add in right away. And 2 of my other favorite supplements to recommend for cancer, the next one is mushrooms, so medicinal mushrooms. And we might have mentioned this briefly in one of our other sessions together, but medicinal mushrooms are mushrooms that have been used in Chinese medicine, herbal formulas, and probably Ayurvedic formulas for, centuries. But these are things, if you've heard the terms reishi, shiitake, maitake, cordyceps, and turkey tail are some of the most common ones that we use for ourselves and our pets. And turkey tail has actually been the most extensively studied mushroom specifically for cancer. So a lot of people have heard about that or read articles about it. Even mainstream veterinarians and emergency clinics that are diagnosing cancer are literally recommending to people to go get turkey tail mushroom for their dogs. So this information is really getting out there. And mushrooms are just a superfood anyway. So they're fantastic. I like to recommend them for everybody, but absolutely for cancer. Some of the things that mushrooms provide is they're very immunosupportive. So they really support the immune system to be stronger. And they are anti-cancerous because they're anti-mutagenic. So they help to prevent cells from mutating. And they literally make, like I said, the beta glucans actually help the white blood cells of the immune system to be better defenders for the body, so the immune system is stronger. Mushrooms also provide dietary fiber, vitamin D, which vitamin D, if a pet or a person is low in vitamin D, they're more associated with getting cancer. Okay, so if you're low in vitamin D, you are more prone to more inflammation in your body and a higher risk of cancer. So mushrooms and other foods are a good source of vitamin D. And mushrooms also have prebiotics and a lot of minerals and things in them. So a wonderful thing to be adding into the diet for everybody. And I take my mushrooms every day, and my doggie gets her mushrooms in her dish every day as well. But a fantastic thing to do as one of the things on the list for anybody with cancer.
Yeah. And I had no idea about all of that. I knew mushrooms were so healing, but I didn't know to that degree, and specifically which ones. That's awesome. So yes, go on.
Absolutely. Yeah, fantastic. So, I mean, I'll just add, a quick little tidbit in there too. Each of the mushrooms can have their very specific things that we know of that they support for the body, but they all have immune system properties, and all of the benefits that I just rattled off briefly. All the mushrooms, have those benefits, but there are certain ones that are very specifically helpful for other things too. Like reishi is known to be very good for kidneys. And it's also called the mushroom of life, by the way, and the mushroom of immortality. Cordyceps is fantastic for, it actually opens up the bronchioles and helps the body to oxygenate its cells better. So cordyceps may be in a lot of formulas that are for dogs or for people if you have respiratory or cardiovascular issues, or you're recovering from something where obviously it's very helpful to for the body to be more oxygenated. It's in a lot of fitness formulas for people who are really into performance and activity and stuff. So just a quick side notes for people to get a good understanding that there are a lot of wonderful specific functions of some of the mushrooms as well. So
I am making note of a different Facebook Live that we need to do in the future, all into the mushrooms, because it's really fascinating, all the different ailments that each treats too. So we'll do that. We'll do that.
Yep. And that's of course why they've been combined in a lot of Chinese medicine formulas for centuries, as I mentioned, because they do have such a wide array of attributes that have been used in many different ways. So yeah.
Yeah, you were sharing three with us before I interrupted you.
Yeah. Oh no, absolutely. So the next one, if you didn't have more questions for me to answer yet on the mushrooms, is the third supplement that I really like to make sure I discuss with all of my clients that have pets experiencing cancer, or that just want to look into preventing and that as well, is CBD or cannabidiols, cannabinoids, which of course are from either hemp or cannabis plants. So these are products that I'm sure most everybody that's tuned in today has at least heard of. At this point, they've become very, very talked about, and in huge focus in both human medicine and veterinary medicine. Unfortunately, as a California veterinarian, I'm still not allowed to dispense cannabis or hemp-based products, even ones with no THC in them. I am not allowed to dispense them, but as of January 1, I'm allowed to educate and talk about them, which is fantastic. Veterinarians in other states do not have that limitation at this point, and we're expected probably in about a year's time to be able to dispense. But for now, there are other resources that I direct people to, and Amanda and I can talk about that in just a few moments, but I can speak to the attributes of cannabis medicine or CBD. And just to give a brief description, cannabinoids are a part of the plant, a constituent in the plant that can actually be extracted separately from the THC. So you can certainly get medicinal forms of CBD that have no THC in them at all. And to clarify, THC is the component in the hemp or cannabis plant that lends to the psychotropic effects, or what people would call a high. Okay, so if there's no THC in the product, your pet is not going to get high. They could still get sleepy, and especially if you give a larger dose of CBD, but the safety of CBD is absolutely fantastic, especially if there's no THC involved. Okay, not that THC cannot be safely used, you just have to be more conscientious of knowing the proper dosing and, being more cautious when giving that type of product to your pet. But just know that both CBD and THC have fantastic anti-cancer properties, okay? And CBD alone without THC is very medicinal, and it has many, many benefits. And it's truly become one of my favorite herbs to recommend because of its versatility and its safety. And when I say versatility, I'm just going to rattle off several things that CBD does. And honestly, I can't name another herb, and certainly not a conventional drug, that does all the things that CBD offers. Okay, so to start out, it's anti-inflammatory. We know all disease is inflammation at a core level. So really, you can make a case for using CBD for just about anything. CBD is pain relieving, or what we call analgesic. So if there's pain or discomfort involved, obviously a lot of people use it for arthritis and other pain. Same for pets. It's anti-cancer, obviously, as our topic today. It's anti-seizure. It's found to be immune modulatory. It supports the immune system. It's in the classification of herbs that are called adaptogens, which Amanda would know very well because there's a lot of fantastic Ayurvedic herbs that are also termed adaptogens. And what adaptogen means is it's something that helps the body to adapt to stressors, okay? And that could be mental or emotional stressors, but it can also be physiologic stressors, things that are going on biochemically in the body. For instance, pain is a stressor. That's going to stress the body. And the body typically will handle a lot of those functions with the adrenal glands. That's one of the major functions of the adrenal glands, is to help our pets' bodies and our own bodies deal with stress. And products like CBD, or herbs and plants like CBD, will really help the body to adapt to those stressors better, so that the body doesn't succumb to illness and as many degenerative changes through, the process of healing and trying to rebalance. So again, and there's even more, but that's just a short list of some of the benefits that cannabis medicine can bring. And thank goodness it's rolling out from under the carpet. That's been, a lot of the governments have been trying to kind of keep it suppressed. And it's really hitting the scene and really offers such a big advantage over a lot of chemical drugs and big pharmaceuticals. And I'm just thrilled that this is coming into light. And there's great people to educate us about it. And I'll let Amanda tell you a little bit about somebody that I'm using as a resource to recommend for education all about this.
Yeah. Wow. That's fascinating. And so, I always think about with CBD, how multifaceted and just how much, the hype is around it. Sometimes these things that get that much hype are like, okay, everybody calm down a little bit. But the more I learn about it too, the more you've taught me, the more I've experienced it with my own animals, it is extraordinary. And I always tell people, like, yes, I know there's a lot of hype, but it's worthy hype, because it really is absolutely it takes healing to the next level. Like you said, it just is so versatile and safe.
Yep. And actually, I just realized one thing I didn't mention on the list that is a very common reason to use it is for stress and anxiety and any kind of mood support. So obviously, that's a big thing that people use it for, but it's absolutely a big thing that pet owners use it for as well, because a lot of our dogs experience anxiety for many different issues, whether that's separation anxiety or multiple other things, thunderstorms, noise sensitivity, CBD, groomer visits, vet visits. I mean, CBD can literally be a game changer, an absolute life changer for many, many reasons. And like you said, honestly, the hype is really valid.
Yeah.
So
it is. And I saw two quick stories of CBD in my own life is Graham, my dog, that had seizures years ago. He'd been on CBD, and then there was a trigger that caused a light seizure a month ago or so. And he was having the seizure, and we ran to the kitchen, got the CBD, brought it back, put it in his mouth, and you literally saw him. You saw his pupils go from huge to smaller. You saw his rigid muscles, his arms were sticking out like this, and they softened. You saw the clenching of his jaw relax. Within 20 seconds, I'd say 30 seconds, 1 minute later, he was out of the seizure. It was phenomenal. I couldn't believe it.
Wow.
And
that is
yeah,
incredible. Absolutely incredible.
To watch it like that with your own eyes. One thing to watch that on YouTube because I've seen it there.
Right. Yeah. What a strong, and passionate testimonial that you can share with people from experiencing that. I mean, like I said, talk about a life changer or a game changer. So,
I heard one part about that story is what was also very interesting is Graham, even in the midst of his seizure, and they're all panicked, obviously, he was like lapping up the CBD. I couldn't get it in his mouth fast enough. So even in that moment, he knew what would help him instinctually, I think.
Yeah. And that's actually a great point to bring up too, is that I've had a lot of pets, dogs and cats, that readily take it. It's like they like it. They know it's good for them. It is one of the herbs that I recommend often that does not taste bad. I mean, the vast majority of pets are perfectly fine eating CBD. They'll even lick it off your hand. And it's fantastic even for cats because there's so many herbs that are bitter and really hard to get in kitties or finicky, dogs or animals. And CBD is wonderful in that regard as well. And usually the volume that they need is so tiny, it's very easy to give. So another wonderful asset about it.
I noticed too, when I'm giving it to the two dogs in my house that actually need it, the other two are like, always like, can I have just a drop? So it's like,
right. Yeah.
It's hilarious.
Yeah.
And then on the way here, we're in Sedona this weekend, and that's why Dr. Katie and I are doing this on Be Live and not physically together. So on the drive up here, we brought Violet. So Violet's newer to our life. For those that know us, know that we have a new baby, and so she's this is probably her first long road trip with us. Well, it is her first long road trip. And, the first hour she was fine. But after that, she started to get really nervous. And then she started to have a full-on anxiety attack. So she was freaking out. And so I climbed in the back and I had the CBD with me, of course. And I gave her the CBD. I used a little bit of my flower essences just to rub on the inside of her ears and on her belly. And again, this was a little bit slower because, it was just a little different experience, obviously.
Right.
But probably about 2 minutes later, she finally sat because she was just pacing around the car the whole time. She finally sat down. And then about 1 more minute later, she laid down. And then I stayed in the back with her and that made her feel comfortable. And she was fine, the next couple hours. And then after that, she forgot about it. So I just thought if I hadn't had that CBD with me, imagine the suffering that she would have endured for this 10-minute drive.
Exactly. And I'm glad you brought that up because that's another fabulous use for it. I mentioned, groomer visits and things like that, but just car travel alone. And so many people used to medicate their pets with things like, Dramamine for motion sickness or Benadryl. I mean, people would literally use diphenhydramine or Benadryl just to kind of make them sleepy and knock them out. And CBD is such a better alternative. It's so effective and so safe and so natural. And on the point of being natural, here's a fun little tidbit to share. something that I learned a few years ago now in one of the veterinary lectures that I went to on CBD at a holistic vet conference. And Dr. Rob Silver was talking, and he talked about how, our own bodies and your dog's body, we make our own cannabinoids, okay? They're called endocannabinoids because they come from within the body. And one of the places that is most high levels of cannabinoids they actually found is in mother's milk. And they did these studies in humans. And so I'm certain this applies to animals as well. But when everyone knows, you can have a baby that's upset and, crying or anxious or whatever. And when babies start to nurse, they become very content. And some of that may be from the bonding, but they've shown biochemically there are a lot of endocannabinoids in mother's milk. And so babies relax, babies become content, they feel good when they nurse. And part of that is because of cannabinoids. So wow. It's very natural. And so when you're taking a CBD or a cannabis-based or hemp-based product, you're just getting plant-based cannabinoids to help your body. But these are things that our bodies have receptors for because they also come from within. And we're just getting a little extra help from a plant. Yeah.
It's great. And obviously that's a fascinating topic, and a topic that a lot of questions come up around because there is some misinformation out there, and then applying it to animals is always different than it is to humans. So we are diving in with this specialization into our next Facebook Live, everyone. So you might want to mark your calendars now for March 9th, 10 a.m. Pacific time. We are going to be talking all about CBD. So the topic is CBD for dogs and cats, and Robin Lynn is someone who works closely with Dr. Kangas and is working more and more closely with her to really help support her patients that need the cannabis or the cannabinoids or the CBD, and wants to be able to, support that, answer all their questions. She's what is her title? A certified cannabis specialist. Yep. And works closely with the vet tech. Is that correct?
Yeah, she actually works with a veterinarian who's a retired veterinarian in the state of California, but they're both certified cannabis herbalists. So they have extensive knowledge on cannabis medicine for both humans and animals. And so Robin's a fantastic resource. And she has her office called 1 Minute Cannabis in Oceanside in North San Diego area, and will be coming to my practice also to counsel pet parents there. And she'll be offering some educational things there, as well as she's already been doing that, and does phone consults and all kinds of things. So she can really provide, when she gets a detailed history of what's going on, her role is to be an educator to help guide people to the product that best matches the needs for their pets or even themselves or another human family member as well. So
it's great.
Yeah.
It's great. I really look forward to having her on. I have a million questions already, but I will reserve them for next week.
Right.
And then next month rather, and then we'll be able to dive into that. So we did have some questions come in from our group here. Thank you everyone for your comments. It's really interesting to hear some of your feedback. And Kate, you're so awesome, Kate, in kind of summarizing what we've been talking about. Kate, you officially have to come to every single Facebook Live I ever have for the rest of the time.
Thank you.
We can talk about that offline. Send some dog biscuits or something. Okay, so let's see. Ella has a question here. I'll put it up. How many CBD, Ollie, what does this mean?
Yeah, so I could get a calculator. I mean, maybe we should cover that in the next one. Yeah. I don't know. I can tell you that what veterinarians usually do, but this won't mean much to you without me giving you an actual dose. But we generally use 0.1 to 0.5 mg per kg. Then we have to figure out pounds. So off the top of my head, I would have to figure out a dose. And since I don't dispense it, it's kind of hard for me to know a dose right off the top of my head. But that could easily be figured out. I don't know if we want to give doses here or wait till our next session, but I could certainly work on that for you. So yeah, but I do, on that, just a great question posed. I have so many people come to me where they've already purchased a CBD product for their pet. And obviously there's numerous places to get these from online, nearby dispensaries, pet stores are selling CBD. So there is a large array of products out there. And the labeling is very unregulated. I mean, there's just, it's very confusing. And so this will be a topic that we can have, Robin cover in a little more depth next time we meet. But people will come in all the time and say, I have a CBD product. How much do I give? And I'm like, I have no idea, because I don't know what the strength is. So even if I give you a dose for your dog, you have to know how many milligrams per, mil or per dropper. And sometimes you can't tell very easily at all by looking at the bottle. And you have to divide how many mils or ounces are in the bottle into what it says, the milligrams for the whole bottle. If it's 500 milligrams of CBD and it's a 1 ounce bottle, you have to divide 500 by 30 milliliters to know per mil, which is usually a dropper. So it gets a little confusing. And sometimes I need to ask my pet parents to, my clients to send a photo of the bottle or call me back or something. But now I really like to send them to Robin for a good resource for not only dosing, but the best products to use, because there are so many out there. And I've had several people tell me that they tried CBD for their pets and it didn't seem to work. And sometimes I think that's more a function of how the product that's been used and how it's been dosed, and maybe even the frequency that it's been dosed, because obviously things work different in every individual, but the majority of dogs are really going to benefit from a CBD if it's a quality product and it's dosed appropriately.
Great. And I think as the laws change and loosen up about this fabulous supplement, the labeling will become more clear, and maybe a bit more consistency will run through the whole channel.
Yeah, I bet Robin could shed some light on that, because that's something that I'm not aware of the logistics of, but I'm sure that'll be changing, and I would hopefully expect so.
Okay, so going over to Ella's other question here. She says, what do you think of curcuma, boswellia, and blackberry leaf?
Curcuma spelled differently, I would think. But yeah, those are all, now for cancer specifically, I'm not sure of boswellia is very commonly used as an anti-inflammatory. I can't really comment on that mixture of herbs or the other two specifically for cancer. I haven't used them. I use Western herbs and Chinese herbs pretty extensively, but I'm not familiar with using those three together. So if that's curcumin, obviously, I'm assuming that's what you're referring to. But curcumin, which is comes from turmeric, most people have heard is definitely anti-inflammatory and has anti-cancer properties too. So there's a lot of products that have curcumin in them, and even boswellia. I don't know about blackberry per se, black pepper oftentimes, and I'm sure Amanda's aware of that. Golden paste is a really common little trifecta formula of curcumin, black pepper, and coconut oil are fantastic together. And black pepper actually potentiates or helps the absorption of curcumin or turmeric into the body, and allows it to be, more functional and bioavailable to the body. So that's a really wonderful formula.
That's great that you share that, because I see a couple other questions came in about that exact topic. So
perfect.
Your premonition, your intuition. It's great. And yes, someone had asked for, Kate had asked for Robin's information. I will post it below, but it's perfect. 1 Minute Cannabis. Is that what you had said?
1 Minute Cannabis. Yep. And her office, just quickly, her office in Oceanside is fantastic. She does phone consults, so you don't have to go there, but her office is set up almost like her facility is almost like a museum, but also classrooms. And she educates human healthcare practitioners, doctors, nurses, physical therapists. She'll have classes for people, for humans with cancer. How can I, help myself with these types of products for whatever condition I've got. And she has presentations on cannabis for pets and all kinds of things. So she's a fantastic resource.
Great. Yeah. And like we said, we'll get to share more time with her on March 9th. We'll get to get all these questions answered, because it's definitely the topic that comes up most in what our audience is asking. So we'll take one last question before we wrap it up here is, will CBD work to dissolve lipomas?
I've not seen that yet, but it could be. I mean, and that's a great question to lead into this comment that I can make for everybody, is that CBD is absolutely beneficial orally, but it can be very beneficial topically too. So I would always support using it on, anything on the skin, definitely a tumor. I would apply it topically to a tumor. I don't have an established amount of clinical experience with putting it on a lipoma to know if that would shrink it, but I would certainly try it. It can't hurt. And I've seen wonderful things happen. Even essential oils like frankincense and things like that are known to shrink tumors. I've seen lavender do it. I don't think I've had enough people use CBD topically to give me good responses yet on how that specifically acts for lipomas, but I would absolutely try it.
I'd heard of a friend that was giving its dog, his dog got a huge tumor on his nose, and he put the CBD oil on there as well as giving it to him in, ingesting. And they had given the dog just like a couple weeks to live, and that entire tumor dissolved. And the dog was thriving afterwards.
Yeah. So the power of plant medicine. How wonderful.
Yes, definitely. Yeah, well, very good. You can't help. That's a magical tip, that's for sure. So we're so grateful to all of you for joining us today, for all your great comments and your feedback. Please do share this out there. We want to just continue to spread this message, obviously in supporting our canines with cancer and other ailments, but also we will get into many different topics throughout these conversations that we're having around, and pretty much everything supports humans and dogs. So it's a nice way to just kind of get some great information from a trusted source, and very knowledgeable source, obviously, in what helps us and our beloved animals in our lives. So we're very grateful to all of you again for being here and for loving dogs and cats and each other in the way you do. Thank you, Dr. Kangas, again for your time this beautiful Saturday morning. And if anyone has any other comments, questions, put them down below. We'll keep our eyes on that. We'll see you with Dr. Kangas. We'll be together again on March 9th, as mentioned, all about CBD. But I will see you next weekend, next Saturday, for our regularly scheduled program. So have a wonderful rest of your day, everyone. Thank you. Bye.
Thank you. Bye.
Bye.